this is not a one person. This is everyone. And every one of those people have their own family. We know enough in how to take care of each other, and yet people don't do it. So that's why I'm like so surprised that people are still like questioning it or arguing about it and putting a politic idealism rhetoric behind it. It's pretty easy. We all need each other and we have to keep each other safe.
As a medical professional, do you think that we have the leadership that we need in order for our communities to actually understand what's going on, the factors that increase this surge, and why they need to take it seriously?
I think that it's very dependent on the community, because I live in a small town in Texas, and the feel is very different in bigger cities. I think that the information is out there, but also there's a lot of disinformation. And there's a lot of politicizing one way or the other, this issue. And I think that's where the big the big miss is right now. We need clear information. We need unbiased information. And there's a rhetoric of everything is a lie. Medicine is ever changing. What we have learned from this virus from 5 months ago to now is huge. I feel more confident right now in the care that I'm giving my patients because there's so much more information. And we have to stop pointing fingers and finding fake news versus true news. Let's try to do what we know is true and objective. This is a very infectious virus. We need to take care of each other. A lot of people can die or get very sick from it. And the most important thing, and the thing that I have been telling people over and over and over, because the thing that people has asked me the most, but the flu kills a lot of people, even more so than that. Yes, but it doesn't happen in one instance. We never had an ICU that was overrun. We never ran out of vents. And that's the problem with this virus. It overwhelms the system, the health system. And then if all my beds in the ICU are taken, and God forbid, you get into a car accident and you need a ventilator for other reasons, then I won't have one for you. And that's the big fear. That's the big problem. If you overrun hospital systems, then more people are gonna die, but not necessarily of the virus itself.
Seeing the surge that's happening, is this considered the second wave, or is just this part of the first wave and we still have more to come during the fall?
I think that the virus never went away. We did a lot of good work lowering the curve, and then when everything started opening, then we are seeing what a second spike looks like. We're not done yet. I think that, and it's becoming worse by area. So in my state and my town, we're at the beginning of the surge. So there's more to come. I'm concerned about influenza. Influenza is deadly, and we never really recognize it as such. Whenever we have this flu, and a lot of people die from flu, when you combine those two, then I think this is gonna be difficult.
Because of the lack of equipment, lack of supplies.
We're gonna have lack of blood. We're gonna have lack of a lot of things that are needed for the work that we do every day to keep people healthy and alive.